cold feet, and hands, is a fairly common complaint amongst patients. This section is devoted to the symptoms of cold feet that are not due to a blood vessel blockage. If you are suffering from feet that are cold and appear discolored, may be painful when at rest or when trying to walk a short distance, or perhaps burn or tingle, this may be a sign of poor circulation, and immediate medical attention is required. In most instances, cold extremities can be weather-related. Cold temperatures have a constricting effect on blood vessels, which will decrease the flow of blood to the hands and feet. However, there are other factors that will cause these symptoms. These include a poor functioning thyroid, anemia, Raynaud's disease, rheumatoid arthritis, lupus, high blood pressure. People who have chronically cold hands and cold feet should have a complete workup to rule out the above-mentioned conditions. Assuming your tests come back normal, here is a list of things you can try to improve the situation. Treatment for cold feet. 1. Wear warm clothing. Seems like an obvious statement, but one of the problems many people do not realize is that cold weather constricts your peripheral circulation, thereby increasing blood flow and heat to your torso. By wearing very warm coats and protecting your body heat, this counteracts the peripheral constricting process. 2. Do not smoke. I know this is easier said than done, but smoking causes vasoconstriction on your circulation. Just like exposure to cold, tobacco clamps down your arteries, decreasing blood flow to the feet. 3. Eat warm food. It is not so much that warm food warms you up, it is more that warm food requires less body energy than cold food in order to be digested. This leaves more body energy to help keep you warm. 4. Avoid coffee. Drink tea instead. Caffeinated coffee constricts blood vessels, as does all caffeinated drinks, but green and black tea contain flavonoids which help support blood vessel health. 5. Nutritional supplements. Magnesium 1000 mg per day relaxes blood vessels and helps promote blood flow. Too much magnesium may cause diarrhea. Hawthorn berry and resveratrol supplements helps maintain the integrity of your blood vessels. 6. Aerobic exercise. Regular exercise such as walking, preferably indoors in cold weather, is a great way to promote better circulation to your feet. Here in the Northeast, where we tend to have cold, damp winters, there are 2 conditions that I see a lot of related to this discussion. Superficial frostbite, also known as chilblains or pernio. Most people think of frostbite as a condition that occurs when you are abandoned in the Canadian Rockies for a few days. Believe it or not, you can develop superficial frostbite doing nothing more than walking 4 blocks to work every day wearing nylons and dress shoes in the middle of winter. I have also seen it in people who work outdoors all day, such as construction workers or deliverymen. Depending on the quality of circulation to the feet to begin with, exposure to cold, damp weather will further constrict the blood vessels that go primarily into the toes. This diminishes the blood flow to the skin, which starves the skin of oxygen and nutrients. The patient will present complaining of pain in some or all of the toes. There may also be itching. There is usually a blue to red discoloration in the toes. In the slightly more severe case, the toes may begin to ulcerate and thereby run the risk of becoming infected. Treatment obviously is to avoid exposure to cold and to habits that potentiate vasoconstriction of the vessels, e.g., smoking. In those individuals who suffer from this repeatedly and have tried all the easy solutions, I will occasionally put patients on Nutritional about 3 months before the winter months in an effort to improve blood flow to the foot. They can stop the medication at the end of winter. Read the complete article at www.fot-pain-explained.com/cold_feet.html